that I've referred to over the last couple of months, and they are posted in various sites. I sent you links to the different studies. Some of the things that could be causing these problems are amplitude modulation, lack of nighttime abatement. In other words, if you can't sleep, you get sick. Audible low-frequency noise, inaudible low-frequency noise, tonal noise, stray voltage, and visual impacts such as shadow flickering and flashing lights. And just a couple of other points here. So, one of the major points that was made in the Environmental Review Tribunal is that they can cause harm if they are placed too close. And there was a great deal of concern expressed in the Environmental Review Tribunal about the Director's apparent lack of consideration for the indirect health effects and the need for further work on the MOE's practice of precaution. They did call for further research, and they feel that the question has not been settled. Everybody would benefit from more information. The World Health Canada said at this time, World Health Organization said in all cases, noise should be reduced to the lowest level achievable in a particular situation. Where there is a reasonable possibility that public health will be damaged, action should be taken to protect public health without awaiting full scientific proof. In Australia, they have recommended a 2-kilometer setback, and the Australian Senate said that the committee recommends that the Commonwealth Government initiate a matter of priority through adequately resourced epidemiological and laboratory studies of the possible effects of wind farms on human health. The New Zealand wind turbines were initially welcomed by many communities due to their environmental credentials. Residents living within 2 kilometers of a wind turbine installation reporting lower overall quality of life, physical quality of life, and environmental quality of life. Those exposed to turbine noise also reported significantly lower sleep quality. In La Gaspésie, there was a group of physicians who put together a position and said, given the risks and potential negative effects of industrial wind turbines on the health of human beings living near these installations, we, the undersigned, have signed the above petition in order to request that the Government of Quebec put a halt to any and all such projects being planned or underway in inhabited areas until such time as research is sufficiently advanced to enable our health authorities to determine beyond doubt what is the safe offset distance that must separate such a wind turbine from a residence. They have issues on Wolf Island. One of the recommendations that came out from Dr. Leventhal, who was testifying on behalf of Suncor, was those exposed to low-frequency noise may adopt protective strategies such as sleeping in their garage if the noise is less disturbing there, or they may sleep elsewhere, returning to their own homes only during the day. To expect people to make those kinds of concessions so that we can stick wind turbines up that we're not absolutely sure are going to produce enough energy is beyond reasonable. It's beyond reasonable under any circumstances. Other countries that have done this ahead of us are now shutting off turbines at night. They are moving them off land, offshore. Japan, which you would expect to be the country that's first in line to be putting up wind turbines after their nuclear accident, has placed a moratorium on any further wind turbine development. We need to get ahead of this. I realize people think this is a solution. It is not a solution. In fact, the Independent Electricity Suppliers of Ontario, which has an hour-by-hour output graph showing what the capacity is of all sources of electricity in the province and what they're producing at, has shown that those wind turbines that are currently in existence, when we've needed them most in the past a couple of years are producing at 0 to 4% of their output capacity. If they were a furnace, they would not get an Energy Star rating. They're not producing, and we're putting people through hell. There are a lot of people sick. I have talked to a lot of them myself. We have to get ahead of this. We need to wait. We need to do the studies. We need to, before we put anything forward, we have to step out and do what we should be doing and make sure that they're safe. So I'm asking for your support. It means a great deal. I have thousands of emails on this subject from my constituents. It's a very, very big concern. So I'm just asking for your support. Thank you.
Okay, thank you. Anyone else wish to speak on the motion? Gil?
Yes, Mr. Chair, through you to Dr. Noseworthy. So has there been any change in position from the Chief Medical Officer of Health from the last statement that was issued that you are aware of?
No.
Okay, any further comments, questions on this? Yes, Gil?
Well, then can we have a recorded vote, Mr. Chair?
Recorded vote, yes?
And
Okay,
I might add about the Chief Medical Officer, sorry, go ahead.
yeah, I got that first, yeah.
Yeah, I think when we hear, and I get emails from the other side of the coin, I get them from the wind generators as well. I think we took a position some time ago about shipping nuclear waste through the Great Lakes, even though it was presented to us as being a safe issue, that all of the safeguards were going to be in place. There was still sufficient concern that health units and others came forward and said, we don't think this is a good idea. We don't think we should be shipping nuclear, I guess they were turbines or whatever, but they had been exposed to nuclear energy, and they were, while they were at low level, the plan was to ship them through the Great Lakes and send them to Sweden, where they would be decontaminated or put into safe storage. We took the position at that time that it was a potential harm to the residents bordering the Great Lakes and a potential harm to the drinking water of a significant number of people on both sides of the border. And I think that even though it was presented to us as being safe, we came out and said we didn't think it was a good idea to do this. I think what we're being asked here is not to say, no, never, ever will we allow this to happen. We're being asked to say, let's get all the information we can. I certainly am very concerned about the setbacks. That is my big issue, other than the fact that I'm severely ticked at the province about taking the right of municipalities out of the equation because of the Green Energy Act that says we are not allowed to interfere or tamper in any way with any construction that has to do with green energy. I try and put that aside when I think about this, and I think that for all of the reasons that we just heard and the facts that it's an unknown situation, that all we're being asked to do is support a request for a moratorium. We're not being asked to dam these things forever. We're not being asked to man the barricades or do anything else. So I think it's a reasonable request for the health unit to say, we have concerns about this and we think maybe there should be a moratorium. Thanks.
Okay, thank you, Doug. I gotta go to Heather first and then Gil. Yes?
Just to address Gil's point with respect to the Chief Medical Officer of Health's report, it was part of the Environmental Review Tribunal, and one of the and the conclusion at the end of the Environmental Review Tribunal is that we would benefit from more research, and that would answer a lot of the questions, and in addition would provide a way of knowing what the noise levels are, because we don't currently have a noise testing protocol, and that was one of the concerns that was raised.
Okay, Gil?
Yeah, I just, Mr. Chair, I just wanted to respond to Member Doug about the radiation levels in the steam. Actually, they were steam turbines, and as Mayor of Corbett, I'm a member of the Great Lakes and St. Lawrence Cities Initiative, and so I attend all their conferences, and I too was opposed to them shipping the steam turbines through the Great Lakes with the potential of having an accident that could contaminate the water. However, on further investigation, we found out that the radiation levels were so low in what they were shipping that they were almost negligible, that it would not have it could not possibly have any impact. It would be levels that you would normally find almost in any community. So as a result of that, the Great Lakes is not, that organization, the Great Lakes Cities and St. Lawrence River Cities, are not pursuing that as they did previously. However, what I did suggest to them, and I made the recommendation, stood up and made a recommendation at the last meeting we had, that they should be looking at bringing in, developing a technology so we can deal with those types of things in Canada, rather than, create some high-tech jobs and eliminate any questions whatsoever about whether or not the contamination levels are so high. So just so you know where we ended up with that particular